Hey everyone, this is a Couplefit tutorial on exercises that can be done during pregnancy, and this tutorial is being done upon request that we had from a reader last week. And so basically a few things to consider when you are pregnant and planning to exercise is, first of all, most importantly, is it safe for you to exercise during pregnancy? And so this is something that is very important to check with either your obstetrician or your family doctor or whoever's taking care of you during your pregnancy as to whether it is safe for you to do this. Secondly, you want to exercise in a way that's safe for you, in that if you are very fit going into pregnancy, generally you can continue to do the same types of things that you were doing pre-pregnancy. However, if you weren't active prior to pregnancy, you don't want to start anything new during pregnancy. So if you were living a more sedentary lifestyle prior to getting pregnant, you may want to consider activities more like walking or swimming. If you are going to start anything like weight training, you do want to start very slow, and again, get your doctor's advice in terms of that. So for today's demonstration, we're going to look at just some body weight exercises and modifications you can make during pregnancy to make it safe for you. So again, you're going to want to do this based on your level of fitness. So if you're someone who hasn't done much exercise, then you're going to want to start off very slow. So looking at some different leg exercises that you're able to do. Again, you're doing them body weight. You may want to use a chair, some other kind of support if you're not sure about balance. Okay, so things you can do, very basic things like a body weight squat. So just going down and up. If you want, you can hold it for a few seconds at the bottom. You want to make sure that you keep your chest and your shoulders upright, and as well, again, you can use a chair to hold on to you and guide you, and try to not let your knees go too far over your toes, so trying to really sit back into the movement. You can also do things like lunges, so again, if you need a chair, you can assist, but otherwise you're just stepping back, going down almost so that your knee is touching the ground. You can also do those side to side. And again, you're going to want to try and do maybe 10 or 15 repetitions of these on each leg, making sure to balance it out between each leg. If you find that you're more of an active person going into pregnancy and you're very familiar with these moves, you can do jumping forms of them or do them more quickly. So for things like squats, you can do things like speed squats, so speeding it up. You can do jumping squats if you're very, very fit. Again, as you as your belly grows, you're obviously going to have to modify these exercises and also be very careful in terms of your balance as your belly grows. Another variation would be to do jumping lunges. So those are some basic leg exercises. The other thing you can do for your legs and also for your cardio is just when you're out and about at work, going out during the day, always try and take the stairs whenever possible, and even just go out for basic walks. Try and fit that in throughout your day, and that will really increase your amount of fitness. Looking at some upper body exercises, so some exercises for your arms. So you can do something like a tricep dip. So you just need a flat platform or a chair, and basically you can modify it to your level. So if you're a beginner, you want to have your legs in close, bend slowly down and up. If you're a little bit more advanced, you may have your legs out in front of you, or alternatively, keep them elevated on a chair. Again, down and up, about 10 or 15 reps. That you should feel in the back of your arms or in the tricep. Another variation or exercise you can do for your chest is the push-up. So again, lots of modifications for this based on your level of fitness. So if you're someone that's fairly new, you're going to want to try going off your knees to start. So again, this is for your chest, so you're going to feel it in the front here, and you're going to want to go down and up, down and up. And again, you want to try and keep a nice straight body if possible. If that's too challenging for you, bring your knees in and just bend down like so, and try and make sure that you're focusing on putting most of your weight on your arms. If you're more advanced, then obviously you can do them off your toes. These can get more challenging as your pregnant uterus grows, so you're going to have to try and modify things. One exercise that you can try for your core or your abdominal muscles is the plank exercise. So for this, you're on your elbows, feet straight out behind you, and just in a nice straight line. And this is something that you just hold for as long as you can, whether it be 15 seconds, 30 seconds, or a minute. And eventually you will start to feel some burning in your abdominal muscles. If that's hard, again, this is something that you can modify by starting on your knees to start. One thing to also consider in doing any kind of exercise is if you're doing anything on your back, you don't want to be lying flat on your back after about 16 weeks or so, because at this time the pregnant uterus is out of the pelvis, and as it grows, if you lie flat on your back, whether it be to exercise or even just lying down when you're sleeping, the pregnant uterus sits on the vena cava, which is the blood vessel that runs back up to the heart. And this can reduce the amount of blood flow to the baby and also to you, making you feeling lightheaded or dizzy or potentially even pass out. So one important thing to keep in mind. So again, everyone, this is a Couplefit tutorial looking at some body weight exercises that you can do during pregnancy. Again, you always want to make sure that you check with your physician to make sure that it's safe for you to exercise during pregnancy prior to starting this.